One woman who just recently received her first dose of the vaccine, she is expecting her first child next month.
She spoke with Fox 14's Gabrielle Pfeiffer about her decision and hopes to encourage someone else.
I'm super excited and I can't wait to get baby Hawson here.
The moment Rachel Hayes and her husband found out they would be first-time parents, their hearts were filled with joy. But as the coronavirus and the Delta variant ramped up across the state, worry began to consume them.
I just really had to take time and think about it and pray about it and really, make that choice.
That choice was getting the vaccine. Rachel now 2 weeks in from receiving her first dose.
The biggest concern for me was just the talk about infertility. Another thing was not knowing what could happen to my baby.
Dr. Kara Worley, an OBGYN in Ashley County, says it's concerns she hears about all the time with her patients. Much of that stems from social media.
We have the data. We're still trying to convince women. And the reason is the Delta variant changed the whole face of the pandemic. I have more patients who are pregnant with COVID now, today, than I had combined last week.
The CDC has reported it's not only safe but important for pregnant women to get the vaccine.
The women are really sick. The only underlying risk factor for any of my patients that have COVID now is that they're pregnant.
What led Rachel to her decision?
Several people that I know that are pregnant right now, a couple of them actually have COVID. It's kind of really hit home, and it was like, that could happen to me tomorrow.
Now she's hoping other expectant mothers don't wait until it's too late.
Talk to those professionals, those healthcare professionals. They're seeing it every day.
Reporting in Ashley County, I'm Gabrielle Pfeiffer.